Virtual reality, the next big thing for mental health. With 1 in every 4 of us anticipated to have a mental health problem at some point in our lives, expanding access to treatment has become critical. However, doing so is difficult, and psychological therapy delivered in virtual reality may give a solution. A new wave of psychological research is pioneering VR to diagnose and treat medical conditions from social anxiety to chronic pain to Alzheimer's disease. While VR has been used successfully to treat PTSD since the 1990s, the new programs address a much broader range of conditions including alcohol addiction, claustrophobia, teenage depression, eating disorders, and whatnot. Today's VR content is primarily designed to aid exposure therapy, a treatment for anxiety disorders in which patients are exposed to anxiety-inducing stimuli in a safe and controlled environment, eventually learning that the threats they are worried about are not actually very dangerous. For example, someone who fears heights might visit progressively taller buildings under the guidance of their therapist. Within traditional exposure therapy, imaginal exposures are dependent on patients being able to imagine effectively. And VR eliminates a potential barrier for patients who may have trouble with imagination or visualization. VR aims to parallel reality and create a world that is both immersive and interactive. The sense of presence or being there in VR allows for the stimulation of multiple senses and active exploration of the virtual environment. Using VR allows therapists to use greater control over the intensity of their patients' experiences, resulting in improved therapeutic outcomes. Dave Zielinski's article in HR Magazine focuses on the virtual reality in the form of smartphone applications or the inclusion of AI therapists in virtual reality programs, which might make mental health therapy more accessible to individuals who do not have the time or money to see a practitioner in person. There are some concerns about self-guided virtual reality treatment because when individuals start to self-diagnose and self-treat, buying software off the internet, they open the doors to a slippery slope of mistreatment. It may be some time before VR completely replaces traditional diagnostic procedures or the classic therapeutic couch, but it will undoubtedly play an expanding role in the treatment and diagnosis of mental health and brain illnesses.